Thanks, Sam. A recent study funded by the National Institute of Diabetes and Digestive and Kidney Diseases revealed that people with type 2 diabetes diagnosed during youth have a high risk of developing complications at early ages and a greater chance of multiple complications within 15 years of diagnosis. Here to talk about this is Dr. Egils Bodganovics. He's with Hartford HealthCare. Doctor, thank you for being with us.
Nice to be here.
Great to have you. So tell us more about this study. What did it find?
Well, this was called the Today 2 study, and it was a sort of extension of the original Today study, which looked at kids with type 2 diabetes, not type 1, type 2, diagnosed between the ages of 10 and 17, and they followed them for about 15 years, and at an average age of 26, they actually had 60% of those patients having some complication of diabetes. And this included about 50% that had high blood pressure and about a third that had high cholesterol.
All right, doctor, what are some of the complications that patients developed after a diabetes diagnosis?
Well, there's a bunch of them, but the ones that we looked at in the study include what we call the small vessel or microvascular complications: kidney disease, eye disease, and nerve disease. And if you looked at the people here, again, followed for about 15 years only, about 50% of them had some evidence of kidney disease, about 50% had some evidence of eye disease, and about a third had evidence of nerve disease. So it appears that some of these complications and the progression of the disease may actually be more rapid in these youth or young patients diagnosed with type 2 diabetes as opposed to the more commonly diagnosed older patients with type 2 diabetes.
All right, and speaking of, we think of type 2 diabetes as a grown-up disease, but not so much anymore.
Not so much anymore. Yeah, this is a grown-up disease that's occurring in the youth. We used to call type 2 diabetes adult onset diabetes because it typically occurred in older people that were perhaps overweight. And we used to call type 1 diabetes childhood onset diabetes or juvenile onset diabetes, because it occurred in younger patients that had an attack of the immune system on the cells that make insulin. But now those things are being turned upside down because we're actually seeing a lot of type 2 diabetes occurring in our young. It's a dual epidemic, if you will, of obesity and diabetes. If you look at our children that are obese, they have about 4 times the chance of developing diabetes as opposed to those children with normal body mass index.
All right, tell us, is type 2 diabetes avoidable in young people?
You know, it's certainly, at least in this study, the progression of the disease or the rapidity of it makes it more important to perhaps prevent it as well as treat it. And prevention really comes down to lifestyle modification, because we can't pick our parents, we can't affect our genes, but we can affect the lifestyle. And it really comes down to cutting down on those risks for obesity that actually can be controlled. Actually taking in less high caloric foods and perhaps expending more energy. Right. Less sedentary activity and more physical activity, let's say.
All right, Dr. Egils Bodganovics, thank you so much with Hartford HealthCare. We appreciate your time.
Thanks for having me here.